The sun is still shining. Summer is not over yet, but a new school year is fast approaching. And with the return to class comes the return indoors.
They all had the ventilation, right?
That's correct.
Tom D'Amico is trying to ease any anxiety that comes with it.
But what you're going to see in this building is most of the ceiling tiles have been removed. So the brand new rooftop units will go on top.
D'Amico is the Director of Education at the Ottawa Catholic School Board. When the ceiling panels are back on, a new invisible layer of protection against COVID will be in place.
This is new ductwork that's being placed. So all of this ductwork will be connected to the new units. The new units will bring fresh air in.
The work to improve the air students will share started last year. In this one junior school alone, $600,000 has gone towards ventilation upgrades that will increase the amount of fresh air coming in, and to pay for unit ventilators with high-grade filters in portable classrooms.
So it is a proven technique to prevent the spread. But also, as people know that we're increasing our filter exchanges, we have more fresh air being pumped into the schools at an earlier rate every day before students arrive to school. That's just going to help everyone's well-being, knowing that the chances are I can't be outdoors all the time, and when I'm indoor, the school and the school board has done a great job to mitigate that risk.
The risk that COVID can spread through invisible particles in the air has always been there. Jeff Siegel was among the first in the world to warn about it. Siegel is an indoor air quality expert at the University of Toronto.
The right way for everyone to think about this is a continuum. So it's not like, right now we're about 2 meters apart. It's not like there's anything magic. The virus doesn't know that we're 2 meters apart. It's that the farther apart we are, the safer it is. And the fact that we're outdoors makes this enormously safer. And so, we all have to be looking at this, and this is, common for people like me. We live in a sea of risk. Right? There's all these risks around us in indoor air, and now there's this risk of COVID too. And so everything we do with ventilation and filtration helps us reduce that risk.
The danger, he says, comes from tiny infected particles expelled by simply talking, particles that can travel indoors for longer distances.
The first way we know that if you have low or poor ventilation, those particles by and large don't have anywhere to go. On the positive side, we know that the more we ventilate, the more we dilute the air with outside air. And I can't tell you that increasing ventilation by 20% will reduce disease transmission by this amount, but what I can tell you is every study that's been done has shown that increasing ventilation is beneficial. The more ventilation, the less risk of infectious disease transmission.
The highly contagious Delta variant, the hundreds of thousands of unvaccinated children going back to school, has made the need to address indoor air even more urgent. The Toronto District School Board will encourage more outdoor learning while it spends $100 million upgrading schools' mechanical ventilation systems. But it's a complicated process. Maya Puchetti is head of facilities for the board.
Hello. So this is one of our typical junior, senior kindergarten classrooms. And what you see here is a standalone institutional grade HEPA filter.
At a recent media tour, Puchetti says while ventilation systems are improved, every classroom will have one of these units. Windows will also be kept open, and unit ventilators will run in rooms that have them.
Because 583 schools, different systems, different ages. In some cases, one section of the building has one system, another section has another system. So this was seen as a way of bringing that measure of comfort and security.
But while awareness about the need to ventilate is growing, action is harder to measure. We reached out to more than 24 school boards across the country. Of those who responded, most were working to improve air quality, including increasing outdoor air intake, upgrading filters, or using portable air cleaners in classrooms. A handful of boards said they had made no changes to their pre-pandemic ventilation standards or were unable to reply to CBC questions.
So 8 to 13% of kids having these long-term disabilities.
The unknowns worry parents and health professionals, especially in Alberta where cases are rising and restrictions are easing. Alberta is providing schools with $44 million to make ventilation improvements, but the province plans to stop testing, tracing and isolating COVID cases and to drop mandatory masking.
Terrified and scared. it's kind of tainting the start of kindergarten with all the changes here. I just don't even know what to expect.
Lindsay Kemp's 5-year-old son George has had 2 heart transplants. It means his immune system is weaker and he's too young to be vaccinated. He desperately needs every safety measure. Right now, though, it's not clear if he will have any.
There's many schools that have not up-to-date ventilation. They have no windows. They have windows that don't open. They're jam-packed with kids. So with the airborne transmission, that's a huge issue. And so if we're stopping the testing, tracing, and isolating, as Alberta is, and no masking, it's going to be high risk for George to attend school, and for others, not just George.
Because he's vulnerable, Kemp does have the option of keeping her son home. But she says that shouldn't be the default.
You know, George is a strong, healthy child now, and he deserves to be in person with his peers, and he deserves to be kept safe.
Yeah, I mean, it's an uncontrolled experiment, and it's an uncontrolled experiment on kids.
Siegel has had more than a few calls from worried parents. His advice? Keep raising the alarm.
So what I really tell parents to do is ask the principal or the administrator, you know, hey, what are you doing? And so, you know, what are they doing in the high-risk environments? You know, gyms and physical education, wherever kids are eating. Those are all high-risk environments. So ask about them. The main benefit of that is that the administrator learns that, oh, this is important to parents.
So this is our kindergarten wing in this particular school.
In Ottawa, parents helped drive airborne precautions. Even though there were barely any COVID cases in the board's schools last year, portable HEPA filters were brought into kindergarten classes.
How much of this is about dealing with the feeling of people psychologically feeling safe?
That's huge. It really is. Mental health has to be the #1 priority. When we return in September, I'm not so worried about literacy and numeracy recovery. I'm worried about mental health. So we have to spend time letting everyone know they've been through trauma, and we're supporting them in that area. And if they know the air quality has improved, that's going to make them feel safer about their learning environment.
Feeling safe, it is a moving target. Playing it safe can seem that way too. And here especially comes down to doing nothing less than everything possible. Joanna Brumaliotis, CBC News, Ottawa.